everybody, and welcome to All About Health and Wellness. We're sponsored by All American Wellness Center. Just catch us on the internet at All American Wellness at Comcast.com, and we'll be happy to make an appointment for you. For you old school people who want to use the telephone, 561-863-8779. Give us a call for your free 15-minute functional evaluation. We're brought to you by the efforts of Podcast Junkies. That's Podcast Junkies, Junkeez, and that's podcastjunkies.com. If you have a message and you want to get it across on social media platforms, well, Ben Castro and Christian Perillo are the gentlemen you need to speak with. Today I was supposed to have a guest. It was going to be an attorney who practices in the personal injury field, but unfortunately he was called to court. So today I have to use Plan B. This is a life's lesson. You always want to have a Plan B and have options. So since this broadcast or podcast is called All About Health and Wellness, let's talk all about health and wellness. So I was thinking about this on the way over after I got the phone call. And you know, we are inundated with commercial after commercial about drugs. The pharmaceutical industry is reaching out to millions and millions of people who must suffer these particular maladies based on the medications they're trying to hawk. And that would be medications for people who have mental health problems, medications for people who have diabetes, medications for people who have autoimmune diseases, such as psoriatic plaques on their skin, eczema, psoriatic arthritis of the joints, rheumatoid arthritis of the joints, Crohn's disease, irritable bowel syndrome, chronic ileitis, migraine headaches, and all sorts of different disorders, maladies, and disease processes that are occurring in America. And since they're on there almost every single commercial, it would be reasonable to take your thinking into the realm that, wow, Americans are very unhealthy. And that would be true. Millions and millions of Americans are not healthy. If you watch Facebook and you see all of these muscular people, you see all these people and incorrectly you think, oh, well, they're healthy. No, they're fit. And there's a big difference between optimal health and being fit. And I don't take anything away from someone who has developed a body that could enter a Mr. Olympia contest. It takes a lot of dedication and a lot of discipline. However, that does not infer that they are healthy. If you go to your medical doctor and you get an examination and you get your blood work and they tell you, oh, we don't see anything, and you're healthy, that couldn't be more incorrect. You are absent of any symptoms and signs of disease, which is a whole lot different than being healthy. So let's develop a definition that we can live with and work with that's accurate in what it means to have optimal health. Optimal health would mean that you have, well, optimal genetics. And nowadays, you can get genetic testing done for a very cheap price. You can go to 23andMe. You can go to a number of different sites, Ancestry.com, and not necessarily find out where your people are from, but find out what your people gave you in the way of genes passed down from your grandparents to your parents to you. And there are 3 types of genes that you're going to be concerned with. Genes that function at optimum health, genes that don't function at optimum health, genes that are very poor in their function. And when you have this information, you can now start addressing things like your lifestyle, because if you have certain genes that function poorly and you know you're susceptible to these particular disease processes so that you don't get epigenetic presentation of these disease processes, You start changing your lifestyle. You start taking certain nutrients to um, augment these genetic functions so that you don't get this epigenetic. That means when you have a bad gene, how the gene presents itself in a dysfunctional, diseased manner. You prevent that by giving the genes the extra nutrients and help they need biochemically so that you function normally. Number two, we need to assure that our brain is functioning normally. Hopefully, if you've been watching all about health and wellness, you now know that the main organ, the one organ that controls the body, is the brain and its nervous system components. So when we have a healthy brain, the way the brain is able to communicate to our specialized tissues, to our glands and organs, to our muscles and tendons and ligaments. It does that through the nervous system. So all of the nerves that travel through the spinal cord and leave the nervous system and leave the spine and go to the various specialized areas of the body, so that proper communication to the brain from these specialized tissues, organs, and glands can tell the brain how they are functioning, and the brain can respond in kind by telling these particular organs, specialized tissues, and glands what to do. This is the theory and the premise that chiropractic has had since 1892 at its inception. If the brain and all of the communication aspects of the brain, the nervous system, are able to function unimpeded or by being pinched, then the body should have normal health and normal function. So if we've addressed our genetic predisposition to issues, if we address that we don't have any interruption in our brain's ability to explain to the rest of the body what to do, which means no vertebral subluxations, problems in one of the 33 segments of the spine, where those particular nerves are not able to receive communication from a particular organ or specialized tissue, or the brain is not able to tell that particular organ or specialized tissue what to do. That's an interruption in normal function. The next thing we look at is we look at our energetics. You know, the oldest healthcare system in the world is acupuncture. And the basis behind acupuncture is the balance and free flow of the energy throughout the body. So when someone receives acupuncture treatment, whether it's conventional and traditional through the hair-like needles that they use in specific points, and these highways of energy are called meridians, and along the meridians are where the acupuncture points are located. This enables the acupuncturist to free up any blockages or impediment of the energy so it flows freely as it's supposed to do. Acupuncture is 5,000 years old. It has absolutely stood the test of time. I've recently been studying acupuncture the last few years, and it is an amazing approach towards health. Another area of energetics that we want to address could be treatments if we have issues with our energetics through laser. Laser is an acronym for light amplification through systematic emission of radiation. So class 3 and class 4 lasers are available to people who want laser therapies, who are having energetic issues. And in addition to treating energy in the body, lasers are very specific in targeting each and every cell that is bathed with this healing light to stimulate the mitochondria and the ribosomes, which are two very important components of each and every cell, so that you have proper function of the cell and you bring the cell's function up to a higher level. Another area of energy could be homeopathy. Homeopathy, unlike herb therapy, is totally energetic. There is no chemical inside a homeopathic formula. It is totally energetic. And this is why some practitioners who come from a pharmaceutical philosophy don't understand how homeopathy works. Well, if you understand how acupuncture and how laser and how Reiki, all of these energetic therapeutic healing modalities, if you understand how they work, then homeopathy makes perfect sense. And homeopathy has been around since the turn of the 20th century. And it has also stood the test of time and is quite effective in healing many chronic and even acute maladies. So if we dress our energetics, that's another aspect of making sure our body stays healthy. The next thing we would look at is our biochemistry. Our biochemistry is incredibly important. As a matter of fact, if we go back to that 5,000-year-old treatment philosophy of acupuncture, one of the things that the acupuncturist will also address with you, besides making sure your meridians are balanced and have free energy flowing through them, they will address your diet. Your diet is one of the most important ways for you to assure health and recover from dysfunction and disease. Diet is very, very important. There are all sorts of different diets. My suggestion, without me going and delving into all of the different rabbit holes that we could go through with a particular type of diet, is that you seek a nutrition professional who understands your particular biochemical needs. But in general, let's just talk about some things. The very first thing a person should have when they're dealing with proper nutrition, and if I may, anyone who doesn't think they need to supplement their nutrition is simply uneducated. Your body requires certain nutritional components and certain nutritional regimes that, because of lifestyle or genetics, you may not have enough of. So we don't want to just address nutrition from the standpoint of making sure you get barely enough so that you don't develop nutritional disease processes, but so that you function at an optimum level. And the first one we want to look at is our amino acids. Amino acids are the building block of proteins. And when I mention proteins, the average person thinks of, oh yes, things to build my muscle. No, not just that. Things to help all of the function of the cells in the body to properly perform biochemical function and optimal function. So making sure you have all of the necessary essential amino acids. And when we're talking nutrition and when we're talking diet, essential means you have to get it from outside sources. Your body doesn't make them. So there are certain amino acids that are non-essential. Why? Your body makes them. There are certain amino acids that are essential. Why? Your body doesn't make them and needs them through your diet. This is why it's important to get amino acids in your diet every single day. The next one would be fatty acids. Whether you know it or not, we have anti-inflammatory biochemical pathways in our body. And I'm sure by now everybody in the general public understands the role inflammation plays on functional health issues and disease processes. If you have inflammation in your body, you definitely need to start addressing your lifestyle and your diet, and it needs to include prostaglandins, which are fatty acids. Well, what could be an example of fatty acids? Omega-6 fatty acids and omega-3 fatty acids. So flaxseed oil, fish oil would be considered an omega-3 fatty acid, or black currant seed oil, evening primrose oil, sesame seed oil, borage oil. Those could be considered omega-6 fatty acids. And both the omega-6 and omega-3 pathways are anti-inflammatory. They are the way your body stops and prevents and treats inflammation. So instead of reaching for the Advil or reaching for the anti-inflammatories, which are very, very detrimental to your stomach, your kidneys, and your small intestine, reach for a prostaglandin, reach for a fatty acid, either of the omega-3 or omega-6 category, depending on what your anti-inflammatory needs are, and recognize if you're having to take more of these, maybe there's something in your lifestyle that you're not addressing properly. All right, so amino acids, fatty acids. Let's move into vitamins. Vitamins, extremely important. Well, what is the most important vitamin? The answer is all of them. Each and every vitamin functions with a different particular role in your body. Vitamin A, vitamin B, vitamin C, vitamin D, they're all very needed. Vitamin E, very needed. Vitamin F, which is another way of describing fatty acids, all necessary for the body's optimal health and function. Well, what else could there be? Well, minerals. Minerals are every bit, if not even more important than our vitamins. So it's incredibly important that we get a balanced array of vitamins, minerals, amino acids, and fatty acids every single day. And if we do, in fact, find out from 23andMe or Ancestry.com that we have certain genetic predisposition for disease processes to occur, then there are specific vitamins and minerals that we need to take each day. Let me give you an example. There are certain genes that help the body break down methionine, which is an amino acid that is found in red meats, and it breaks this methionine down to a harmless chemical that we urinate out. But if we don't break it down properly, then we form something known as homocysteine. The knowledge that homocysteine in our blood, homocystinemia, is harmful to us was first brought to the medical establishment's attention in 1948. And that medical doctor, when he brought that across to the authorities at Harvard Medical School, he was laughed out of the school. This is what happens with many pioneering scientists and healthcare providers when they observe clinically that certain things are occurring and there's a pattern that's starting to present itself, and perhaps the healing arts at large needs to be aware of the detrimental effects. Well, eventually that was accepted, and nowadays it's part of the biochemical evaluation that people who are forward thinking and want to stay ahead of the curve are getting, so that they can look at their biochemical function. Homocysteine is a neurotoxin that affects the brain and cellular tissues in such a detrimental way, it eventually can lead to cancer, heart disease, and Alzheimer's. Homocysteine, not evaluated and addressed, can lead to disastrous consequences in our health. So here we are. We've got about 2 minutes left. We've talked about what true health and wellness is all about. You're not going to get advice on true health and wellness by your medical doctor. Why do you go to your medical doctor? If you think you have a disease and pathology, because there's no one better at taking care of those issues. If you have a functional problem, stay out of the medical doctor's office. If you have a disease and pathology, get to the medical doctor and find a good one that can treat you. At All American Wellness, one of the first things we do when we're evaluating a patient for function and we're taking a history, we're looking for one of two things. Is this a disease process? Is this a functional issue? Is this a pathological issue? Is this a functional issue? So during the history alone, we're looking to see what group you fit in. Then we start performing an examination. It's the same thing. Are we dealing with a functional issue, or are we dealing with a medical issue? Many of our patients that come to us don't choose us first. They come to us out of desperation. They have seen all of the medical doctors and they have not been helped. And that's good news. It may be frustrating, but these people are good at what they do. If they can't find your problem, it's not disease and pathology. It's a functional issue. And at All American Wellness, you'll be in the right spot and we'll take care of you. So give us a call. Thank you for being here. Look for us on Spotify, Apple, YouTube, and Facebook. I'll see you next week. Bye-bye.